Hi, good morning, everyone. Welcome to Pediatric Grand Rounds. Thank you for joining us today. Our presenter today is Erin Boush from the Carilion Clinic Community Health and Outreach Director. Erin graduated from James Madison University with a Bachelor of Science in Health Service Administration, and a minors in Business and Gerontology. He received his Master's of Healthcare Administration from Jefferson College of Health Sciences. He currently works as the Director for Carilion Clinic's Community Health and Outreach, where he oversees Carillion's system-wide community health assessment projects, community benefits, grants, peer support, community health workforce, and health education programs. He's on the Board of Directors at the Goodwill Industries of the Valley, and he serves on the steering committee and the chairman for the Data Collection and QI Committee for Healthy Roanoke Valley, a partnership of over 50 community partners working to create strategies to tackle the issues plaguing the health of the area. He has presented locally, state, and national conferences and is a native of Roanoke. Please join me in welcoming Erin Boush.
Thank you so much. And can y'all hear me all right? Okay, great. If there's any feedback, just let me know. But thank you so much for having me here today. I'm excited to tell you a little bit about the Community Health and Outreach Department and what we're doing to move upstream, or really looking at social determinants of health. So today, our learning objectives are to understand how social determinants of health impact health and chronic disease, to explore Carillion Clinic's community health improvement process and understand top community health needs, and encourage participation in the 2021 Community Health Assessment process, which just kicked off. So a little bit about community health and outreach. I have the privilege of serving as the Director for Community Health and Outreach, and I have been here for 6 years within this department. Previously, I worked in strategic development, and then before that in quality. But I've been with Community Health and Outreach for 6 years, and many people that work at Carillion actually do not know that we have a community health and outreach department. But we are responsible for Carillion's community benefit. So as a not-for-profit healthcare system and hospital system, we do what is called community benefits. So ways that we give back to our community as part of our mission. And this information we actually have to submit to the IRS to justify our tax exempt status. So we're responsible for collecting all of the community benefit throughout the system and working closely with tax. And surprisingly, our department fills out a good portion of the organization's 990 for all 6 of our hospitals. In addition, we facilitate community health assessments for all 6 of our hospitals, and we'll dive into that today. We oversee our community investment process specifically through community grants and sponsorships. So we fund various organizations throughout the region. We have a staff of health educators, and I'll talk about that later, and implement community health programs. We oversee community partnerships, and here in Roanoke, we work with Healthy Roanoke Valley, so a group out of the United Way, which we'll talk about in this presentation. And we also facilitate neighborhood health initiatives. And the last several years, we've been focusing on Southeast Roanoke, and we'll talk a little more in detail about that later. We have a multidisciplinary team that includes admin support, analysts, marketing and communication professionals, health educators, dietitians, nurses, community health workers, and peer support specialists. So we're going to start very, very basic. So what affects our health? And pretty much most of us know what good health looks like, or maybe more so what bad health looks like. But what has the most impact on health? So according to the Robert Wood Johnson Foundation, healthy behaviors, clinical care, social and economic factors, and the physical environment. But not all of these factors are equally weighted. So this graphic comes from the Robert Wood Johnson Foundation County Health Rankings. And this is a fantastic website that actually looks at every single county in the United States. It compares within each state. And it gives data that ranks with each state to really show how we're doing. And so they break down social and economic factors as being the most important factors that influence our health. So at 40%, and that includes things like education, employment, income, family and social support, and community safety, followed by healthy behaviors. So things like unsafe sex, tobacco use, diet, exercise, and alcohol use, clinical care, so access to care and quality care, and the physical environment, which includes environmental quality and the built environment. So Carillion's Community Health and Outreach Department, we have been in existence for over 30 years. And historically, we really focused on the left half of this graphic, healthy behaviors in clinical care. But in the last 5 years, we've really started doing more economic and social programs and really looking at underlying causes of different diseases and how we can better influence our health. So this shows county health rankings for our Roanoke service area. So this looks at Botetourt, Craig, Roanoke County, Roanoke City, and Salem. And the scale at the bottom, there are 133 counties in Virginia. So for county health rankings, 1 would be the best and 133 would be the worst. And you could see the way that we have this color-coded is Roanoke City has a lot more health challenges compared to the rest of the Roanoke MSA. And when you start looking at this over time, we have seen the Roanoke City get better a little bit over time, but it still has a lot of disparities, especially when you start comparing Roanoke City to Roanoke County. So Roanoke County for the 2020 County Health Ranking Factors or Health Factors is ranked at 14, where the city of Roanoke is ranked at 109. So there are several things that are very different within these areas. So the median household income for Roanoke County is over $20,000, and more than 18% of families in Roanoke City live in poverty compared to just 6% in Roanoke County. And then the education levels are strikingly different in the areas as well. So one of the things that we really look at is our largest hospital, Roanoke Memorial Hospital, is located in a zip code or neighborhood that has almost 40% of residents living at or below federal poverty level. And so one of the things that we started really drilling into is specific neighborhoods. So technically, Roanoke Memorial Hospital is located in Southeast Roanoke City. And when you start looking at various sections of the city, you could see that there are 10-year life expectancy gaps between Southeast and Northwest compared to Southwest City and other parts of the city. So when we start drilling down from the entire state of Virginia, the city of Roanoke, is already one of the most unhealthy areas within the Commonwealth. But when we continue to drill down, even within the city, we're seeing even more health disparity gaps. So this is one of the things that our department, we look at regularly and really are trying to understand what are the underlying causes of these healthcare gaps and health disparity challenges. So part of the way that we do that are through our community health improvement process, which involves conducting our community health assessment, doing strategic planning to really work together as a community and then as hospitals to come up with strategies to overcome need. The hospital then publishes an implementation strategy report that is available online at carillionclinic.org and on the Community Health and Outreach page that says specifically what the hospital system will be doing to address community health need. We do program implementation and evaluation ongoing, and we use the Shewart cycle, the Plan, Do, Study, Act cycle, to look at our programs and make small changes, and then we evaluate ongoing. And then this cycle repeats every 3 years. We are required by the IRS to do community health assessments every 3 years. So a little about our health assessment report. So the most recent report is 2018, but we just kicked off October 1st, our 2021 community health assessment, which will be available next year. But it includes primary data through community health surveys, stakeholder surveys and focus groups. And rather than traditional focus groups with our target population, we are doing key informant interviews. We didn't feel like during a pandemic it was safe to bring community members together to talk about their health when that would put their health at risk. And the areas that we look at are community level health concerns, individual level health concerns, barriers to health, healthcare, and social services. And then we conduct secondary data from over 40 different sources where we look at demographics, social and economic factors, health behaviors, clinical care, the physical environment, and health outcomes and health status. These assessments can be found all on CarillionClinic.org for all of our hospital service areas. And they go back online to, I think, the 2012 assessments. But Carillion has been doing assessments. We did this before they were requirements, but now we do them every 3 years, so a little more frequently than we used to do. So for our community health assessments, we are assessing health status of residents living in the Carilion Clinic service area, and we strive to target underserved vulnerable populations disproportionately impacted by the social determinants of health, including poverty, race, ethnicity, education, and or lack of insurance. So these were the top needs that came out of the 2018 Community Health Assessment. And I'm going to go through this section pretty fast. And I have some data coming up in the current slides, but this data is a little bit outdated and we are updating this information now. As a community, we form what's called a community health assessment team. So we have over 50 community stakeholders that serve on that team that actually help guide the community health assessment process and help us prioritize our healthcare needs. And we have to have specific methodology that we report to the IRS on how we determine healthcare needs. But in 2018, these were the following needs that came up as priorities. So poverty and low average household income, high uninsured, high underinsured population, affordable safe housing, educational attainment, so culture, healthy behaviors not being a priority, poor diet, access to mental and behavioral health and substance use services, access to dental care, the high cost of care, and transportation and the transit system. So to drill down a little more with some of these are just quick infographics that talk about some of the different data. But some of the things that are really important here, I think, to point out are the percentage of children less than 6 years of age below 100% federal poverty. So in the Roanoke Valley, the average is 21%. Roanoke City is 35%. But then in Southeast Census Tract 26 and Northwest Census Tract 24, we see 76 and 85% of children under 6 living at or below the federal poverty level. We see similar disparity compared to the city and Northeast and Southwest for adults. And that really correlates with educational attainment. And the Robert Wood Johnson Foundation does say that the biggest predictors of mortality, the biggest correlation, are educational attainment and income. The insurance slide is outdated because since this assessment, which this was the 2018 assessment, we have had Medicaid expansion, which has had a big impact on our uninsured rate. But we still see, and one of the greatest challenges that we see are severe housing problems and individuals having safe and affordable housing in the Valley. Respondents of our survey, 19% reported having severe housing problems, 15% in Virginia and 11% in Roanoke County, and 31% reported not having enough money to pay their rent or mortgage. And we expect with the pandemic that this number will be even higher in this most recent assessment. Under healthy behaviors, 60% of respondents reporting having less than one serving of fruit or vegetable per day. And we heard a lot when we did focus groups that individuals have a hard time prioritizing healthy behaviors when they're struggling with their day-to-day life. Under clinical care, 38% reported that they cannot afford the medicine needed for their healthcare conditions. 45% reported cost prevents them from getting the healthcare that they need. And 41% report not having a dental exam within the last 12 months. 26% report mental health care or counseling are hard to get in our community. And we see mental health access being an issue across our entire service area. And that's been one of our priorities as a system perspective, is expanding access to mental health services. For the most important issues affected by our community, in the survey, 31% of respondents said mental health problems, and 42% said drug and illegal or alcohol and illegal drug use. And 43% of adults reported that care was hard to get in the community. And then with the physical environment, transportation continues to be a challenge within our valley. And when we asked our stakeholders what the largest barrier to health was, the number one answer was more access to transportation. And when we look at households that have no vehicles available, Virginia's average is 6%. The city of Roanoke is 13%. But then again, in those two areas of the city, southeast and northwest, we have 31% and 41% of individuals that do not have access to a vehicle. So what does Carillion do with all of this information? So we use it in a variety of ways. So for our strategic development and planning activities, we use it to help develop our community health and outreach programs. We use it in population health management, community development, and the work that my Vice President Shirley Holland does with our planning team. So when we're planning new service lines and new products for our community, we always do that with a community health lens and a health equity lens. Community grant giving, and then selecting geographies for neighborhood health initiatives. And this work back in 2011 and 2012 led to the creation of Healthy Roanoke Valley. Healthy Roanoke Valley is a collective impact coalition. So we really know that we cannot solve these problems alone. We need neighborhoods and families to address these issues with us. And we need to engage our not-for-profit partners and really work from multi angles to really address these large social problems. So relationship and trust between organizations and our communities are the foundation for real progress and for change. So collective impact is out of Stanford University, and it's a commitment of a group of important players from different sectors to a common agenda for solving specific social problems. So really, it's taking multiple people, having a shared vision and shared goals, and addressing an issue from multiple angles, from multiple organizations and multiple disciplines. And this is a best practice to leading to large-scale change. And it focuses on the relationship between organizations and, like I said, shared strategies towards goals. So here in Roanoke, we work with a group called Healthy Roanoke Valley. The backbone organization that supports this work is the United Way for Roanoke Valley, and it was formed after our 2011-2012 community health assessment. We currently have over 60 organizations that come together for our broad-based community coalition. And this past year, we were awarded, 2020, we were awarded the American Hospital Association NOVA Award for our work at developing Healthy Roanoke Valley. And the NOVA Award is one of the highest honors that the American Hospital Association gives to hospitals for their work for improving community health and community coalitions. So through Healthy Roanoke Valley, we have a variety of action teams that work on different collaborative programs to address the needs identified in the assessment. One of my favorite programs that we partner with Healthy Roanoke Valley in is the Pathways Community Hub. So the man on the screen is Kenny Hurt. He is one of our community health workers. He is actually based at New Horizons Healthcare, but I love his quote, "Building a relationship is the key. Some of my clients are my neighbors and friends." So currently, we work with Healthy Roanoke Valley and several different area agencies, New Horizons Healthcare, Bradley Free Clinic, the Fralin Free Clinic, and then we have community health workers in Carillion Internal Medicine at Riverside 3, Carillion Family Medicine Roanoke Salem, Carillion Family Medicine Southeast, and we're just starting a project to get our community health workers involved in the emergency room. But community health workers, they are able to partner with the patient and connect with them on a peer level to help coordinate social determinants of health. And they help coordinate various pathways. There are medical pathways, such as getting established with a medical home or a dental home, but also social determinant pathways, such as housing or healthy food, etc. But what's most important, coordinating care is only one part of what they do, but actually building a relationship with the patient or client and having that psychosocial support and having somebody that can help navigate through the system, but also provide support for that health behavior change and to address those social determinants of health. In our initial pilot with community health workers, we saw some really exciting trends in hospital utilization. So for patients, the 244 patients that worked in the program, we saw a 67% decrease in avoidable ED admissions at Roanoke Memorial, a 73% decrease in subsequent avoidable inpatient admissions, an 87% decrease in length of stay. We saw a 77% reduction in avoidable charity care costs and a 44% reduction in overall charity care costs, saving the healthcare system over $500,000 in the 13 months that this data was collected. Another program that many of you on the phone might be familiar with is our Fresh Foods RX program, which is in partnership with Healthy Roanoke Valley. Over the years, Carillion has done a lot of work with local food development. We have actually given grant funds to multiple organizations that support healthy and local food access, including all of our area farmers markets, the LEAP mobile market, which goes to our food insecure neighborhoods, formerly called food deserts, and provides food. And a lot of SNAP double value matching at farmers markets and supporting community gardens. And in the last 5 years, we funded over $500,000 to our local food nonprofits. But this particular program is one of my favorites. It's an actual fruit and vegetable prescription program we've done it with diabetic adults. We've done it with libraries, actually in partnership with Carilion Children's. And we have also done it in senior centers. And this is a program where we provide health education and then have an on-site mobile market come and provide fresh produce. And this is based off of the Wholesome Wave model. And we saw more than 60% of our participants decrease their BMI and their hemoglobin A1C, and half of them saw a decrease in their blood pressure since we started this program. This program is really hard to scale up though, so we only do several classes every year because it is very resource intensive. But we would really like to come up with a way that we could scale this project and bring it to more people because we really believe in it. So Healthy Roanoke Valley and the Pathways Community Hub are both collaborative programs that we financially and support, as well as support with staff throughout our communities. But going forward, I'll be talking about more Carillion-based programs. So we have another program called our Peer Recovery or Peer Support Department. And that department is led by Erin Casey, and it's housed under Community Health and Outreach. We actually have a peer support center that is located at the rehab building. But peers are individuals that have experience in substance use or mental health issues that go through a training with the state. And Erin Casey, our manager over the program, can actually train individuals. But then it gives them, after they get 500 hours of service, they're eligible to be a certified peer recovery specialist, and they're actually billable with Medicaid. And so we currently have peers that are in the emergency room, that are up on 5 West, that work through inpatient and outpatient psych in the emergency room. I think I already said that. And then some family and community medicine sites. And these peers actually will work with the physician and then with the client to create a recovery plan for individuals and really help them and coach them through their own recovery journey. And this has been really just a great program. We have been working on getting this program better integrated with an EPIC, and we will be rolling out a new EPIC department for our peer recovery specialists in the next several months, which we're super excited about it. We currently have been offering this program completely for free as a community benefit, but we hope to soon be able to bill an EPIC for this program. We also started a urban farm in Southeast. In 2018, food insecurity came up as the top, or actually, sorry, 2015, food insecurity came up as the top need in our community health assessment. And one of the things that we really believe in is we should not go into communities and tell them what they need to do to be healthy. We should partner with communities to really overcome the need and to build trust and build buy-in. So we started having community conversations and going to neighborhood meetings, going to the housing authority sites in Southeast, and asking residents, you've told us that food insecurity was a challenge within your neighborhood. What do you think we could do to address that? And how could we partner with you to address that? And what we learned from the Southeast neighborhood was that back in the 60s, when the Visco plant, it was a nylon plant that's actually, you could see the tower in this position or in this picture right over the trees. It closed down. But back when this was very much a blue collar neighborhood in Southeast, individuals really did have more access to healthy food. And a lot of their friends or family or neighbors had gardens and they grew their own food. And this neighborhood told us that they still really felt connected with fresh produce, but had really lost the skills to grow their own food. And many of them were renting or didn't have a large yard where they could actually grow their food. So we partnered with Southeast Action Forum and I Heart Southeast and secured a grant from the Carilion Clinic Foundation and built an urban farm in Morningside Park in Southeast. It is a stone throw away from the Boys and Girls Club. And we not only heard from that neighborhood that they wanted access to food, they wanted a place that they could grow their own food. So the farm is completely educational and all the produce is used to incentivize programs. But right next door, we have a community garden, which is supported by LEAP and formerly the Roanoke Community Garden Association, where residents of that neighborhood can grow their own food. And since we've started this program a couple of years ago, all of those plots have been rented, and it's only $5 a year to actually use the plot, and we provide the water for free. But we also heard from the neighborhood that they really wanted this space to be a community gathering space because there weren't many community gathering spaces in Southeast. So we had 65 events last year at the urban farm. Anywhere from health education classes to yoga classes to art classes, and then 4 community block parties. And we always end with our annual fall harvest celebration where we have pumpkins for kids, we have hay rides, we have free Brunswick stew, and that always attracts hundreds of people. And every event we have fresh produce that's available that community members can take home for free. One of my favorite stories, and I think that the way that we are planning health programming is so important going forward, but this was one of our first projects where we really built this project with the community instead of for the community. But our first year after we built the farm, we had some compost delivered outside of the fence, and I wasn't there and our farmer wasn't there to have it delivered inside the fence, so they dropped it right outside the fence. And I got a call from one of the neighbors, and he said, "Aaron, I just wanted to let you know somebody is stealing our compost." And the key here is he said our compost, not your compost, but our compost. We had 65 people from the neighborhood show up just to help build the farm. And there's really a ownership of this space, which is really, really cool. And so he went out there and filmed the person taking our compost with his cell phone. And we tracked that compost down and we got all of the compost back, which was awesome. So in addition to our urban farm, we've done a lot of work in Southeast. And this is one of our neighborhoods where we're doing a deep dive in terms of geography. You could see in the illustration on the left, the hospital in the left corner. The hospital is located in Southeast, and we felt like we had to take care of our own neighborhood, especially since the data shows that the Southeast neighborhood is one of the most unhealthy neighborhoods in the Commonwealth. So in addition to the Morningside Urban Farm, we have placed peer support specialists and community health workers throughout that community. We partner with the Presbyterian Community Center and provide free screenings, flu shots. We also have a blessing box where we provide personal care items for the clients that go to that area. We have implemented Fresh Foods RX at Carillion Family Medicine Southeast. We have funded the Valley AFC soccer complex in Southeast. We placed Zagster bike shares in Southeast, but unfortunately that program through Ride Solutions actually just closed. And then we've been working very closely with Carilion Children's and other partners to bring a pediatric clinic to Fallon Park Elementary School. This clinic will be so much more than just a clinic. We're partnering with Delta Dental and Freedom First and other community partners to bring wraparound services and also have community health workers at this site. And I see that Hannah Smith is on the call today, so shout out to Hannah. She has been really part of this program, and one of the first parts for our Fallon Park engagement is our pediatric asthma clinic that is within Fallon Park, and now we're doing it virtually in the patient's home. But we do hope to have our actual clinic open next year. It has been delayed because the bid came back pretty expensive with this last one, but we are still planning on moving forward with that program. In addition, we are working with several different organizations with our department to really help us better understand stewardship and upstream and how we can better change the way that our healthcare system looks at health and looks at social determinants of health. So we have been working with Rethink Health, which is an initiative of the Ripple Foundation and funded through the Robert Wood Johnson Foundation as part of an initiative to help us think upstream and to redesign some of our services. So currently within Rethink Health, we have been looking at how we could expand capacity for mental health and really rally around mental health and create campaigns to reduce the stigma around mental health, but most importantly, build a formal network of mental health providers and build that capacity. So our first project as part of our Rethink Health initiative is really looking at Roanoke City Public Schools and how we could provide a mental health navigation line to help children and families navigate mental health issues and get connected with resources in our community. We're also engaged with Partnering for a Healthy Virginia, which is a partnership of the Virginia Healthcare and Hospital Association and the Virginia Department of Health. And we're participating in a project called Health Begins. So this is, quote, a upstream learning collaborative to really get hospitals thinking about root causes. And we started this project before the pandemic, and we started working on an asthma program with internal medicine. But then the pandemic happened and we weren't able to do the same type of clinical intervention. So we had to shift pretty closely. But we started doing a project that we coined Home Alone, but we actually called adults that were over 70 that were at risk for developing COVID during the lockdown and did some social assessments to try to understand if there are any social barriers, and then connected individuals with services in their home and community health workers. So that was a really great program. But it was funny, we actually didn't find as many social needs as we thought. The greatest needs at that time were actually the need for toilet paper. And so we actually delivered a lot of toilet paper to different people's homes. We also have a magazine that our department puts out quarterly called Easy Health. The fall 2020 issue was just released. Typically, we have this available in print for any community partner or clinical site that would like copies, but with the pandemic, it is just a digital issue this year. But it has all of our health education programs, social determinant programs, but all of our community partner programs as well in one easy place where individuals can find what's going on in their community. We also have a variety of health education programs. So many of you know Jill Lucas Drakeford. She leads our Safe Kids Southwest Virginia program. She is one of our health educators, and she oversees our car seat safety check programs and trains car seat technicians throughout the Commonwealth. And up in the right corner, I showed some of our outcomes from last year, FY19. But we checked through just our screening events, 455 car seats, and 78% in Roanoke and 76% in the New River Valley were actually installed incorrectly when they came to one of our screening events. And so now we're doing all of those events one-on-one or virtual. But our Safe Kids program not only focuses on car seat safety, but road safety, home safety, and school and play. And we have a variety of different programs, including an infant safe sleep education program through Safe Kids. In addition, we have various other programs. I mentioned All In for Mental Health, which is our peer support program. We also offer health screenings and immunizations throughout our community. We're switching more towards a street medicine approach instead of what we've traditionally been doing with health screenings at libraries, where we really have a mobile approach and where we go directly into neighborhoods. And our first experience doing this was actually with flu immunizations for this season. We've had over 22 clinics in our community. They've been mainly walk up or drive through, and we've already administered over 800 vaccines. We have 2 more clinics in partnership with Carilion Children's that we have at various height or school sites. And then this Saturday, we're doing a large drive-through clinic at Riverside where we expect to give nearly 1,000 flu shots if as many people come out as we're expecting. We have several injury prevention programs, one of those being Safe Kids Southwest Virginia, but also a falls prevention program for older adults called A Matter of Balance. I talked about our urban farm. We have a wellness workshop series, which is a 6-week series where we offer nutrition and basic healthy lifestyle tips. One of the things that we're looking at with this program, we now have a dietitian that's embedded with our program and a partnership with a Virginia Tech dietetic internship program. So we have 4 dietetic students that work within our department and for our dietitian. So we're really working at building out this wellness workshop model and having more workshops and starting a urban farm to table workshop. And we find with all of our classes, we need to have incentives. So oftentimes we offer healthy local food. We have a tobacco cessation program called Be a Quitter. We support and have healthy walks and talks throughout our region. We have a program called Let's Talk, and under that program, we have Boy Talk and Girl Talk. So this is a program for adolescent youth and their parents to get them talking about puberty, and then Well Said Health Education. So these are free 45-minute presentations. We have a variety of topics, and we offer these for free for any community group. So why does community health matter? This is who we are. It is our purpose and our mission, and we're a local healthcare company. And we really can't think of anybody else within our community who is better poised to lead this work. But more importantly, it's our community. We live here and it's our region, and we're part of this community, and we think that it's extremely important for us to start focusing on these upstream needs. We're doing it for our community, for our kids, our families, and our neighbors, and we do it for each other. So kind of some call to actions. I would really encourage all of you to complete our 2021 community health assessment. It could be found at surveymonkey.com/r/2021 community health assessment. If anybody would like paper copies for their clinics, you can email me and we'd be happy to deliver some. And you could also call the 1-800 number on the screen, and this will get you connected with Carillion Direct, where we can administer the survey over phone. We also have flyers that have this information that you could post in your clinics that have a QR code that individuals can scan while they're waiting. Also, we love to partner. We partner with Carillion Children on a variety of programs, but we would love it if you refer to our programs and classes. Come out and visit the urban farm. I love to host different departments at the farm. If you would ever like copies of Easy Health or Community Health and Outreach brochures, we have plenty available. And if anybody ever has any ideas for new programs and classes, we have a team of folks that are here that can assist and that can help staff these type of events for your clients. So that is the end of my formal presentation, and I have a couple of questions for you, and then I will open it up for you to ask questions to me. So the first one, according to the Robert Wood Johnson Foundation, what has the greatest influence on health? And I'll give everybody a couple of seconds to think about this. Actually, in the chat, if you would like to put your answer in the chat, and I'll wait until I see some responses and then give away the answer. Yeah, you guys are smart. Everybody pretty much got it right. But social and economic factors, which include poverty. Next question. What geography in the Roanoke Valley has the worst health outcomes? A, Roanoke County, B, Salem, C, Craig, D, Roanoke City. Yep, everybody got that one right. I should have made these questions a little harder, but you guys got that one right too, D, Roanoke City. So at this point, that's the end of my slideshow. I haven't been doing a good job at looking at the chat, so let me look and see if there are any questions. Hannah said that we need CHWs in our ped clinics. I couldn't agree more. I am excited that this year for our Fallon Park asthma program, the kids and the families will have access to community health workers. And community health workers can work with children as well as the entire family. So we're excited to expand that program to the asthma clinic. Tanya, and hi Tanya, it's good to hear from you. She said there's a Safe Kids priority space on the Get Well network. But any other questions? We had a question if we've reached out to partners and other organizations such as CHIP. Yes. So we work really closely with CHIP and Robin. CHIP is actually a partner for our asthma program this year. And through Healthy Roanoke Valley, which we fund and serve on the steering committee, we have over 60 different organizations that we partner with. In addition, through our community grants and other programs, we partner with various organizations. Each year we fund over 30 different nonprofits, and we really believe that this work cannot be done in silos. It can't be done alone. So we believe that it takes everybody working together to address these issues, and we work very closely with our healthcare safety nets throughout the area. Or if you would like to reach out to our general department, you can email communityoutreach@carillionclinic.org. And any ideas or partnerships, we are very open. But I really appreciate everybody's time today, and I hope everybody has a fantastic Wednesday or Thursday.